Hello everyone, and thank you so very much for joining. This is Justruth and Company, a podcast that shares the raw accounts of failures, successes, love, societal, financial, and all the other issues in between that come with adulting, giving you useful tips and advice on how to live your best life possible. This series right now will be looking on COVID virus. Last time we spoke to a medical technologist, Orlando Gray, and today we'll be talking with registered nurse Yolande Tucker. Nurse Tucker works with the Nuvance Health in Connecticut, and she will be giving us an insight as to what it's like working on the front line of this pandemic in the country that now has the highest number of confirmed COVID cases. So thank you so very much for joining me, Nurse Tucker. I really am glad that you're able to kick things off, because I don't know, I am a little bit scared, not panicking, but a little bit scared when I listen and I go to all the reputable sources for my information and find out about how COVID has been spreading and how many persons are currently affected. It's over 1 million in the world. That is alarming. And you're in America, and currently you have the highest number. What is that like? How does that make you feel? Let us start there.
Um, how does it make me feel? As a healthcare worker, the truth is we don't really panic for stuff like this because it's a normal day for us. So like I may go to work and have 5 or 6 patients, and the truth is 4 of them, they're on isolation for whatever the disease is. So it may be tuberculosis, it may be shingles, it may be E. coli, it may be MRSA, it may be C. diff, and these are things that we deal with every day. We go in, we put on our gears, we see the patient, we wash our hands, and we go eat lunch. So it's not abnormal. COVID to me and to a lot of us isn't different. The difference is with those conditions, we had gears, we had sufficient PPEs, and we felt safe. With COVID, the information changes every day, and we don't have the gears. And so it's not a matter of, oh, we're panicking, oh, we don't want to do the work, oh, this is what we signed up for. No, I didn't sign up for this. I signed up for taking care of people with having proper equipment. So it's not that we're afraid. We just want to know that we are safe because we also have families and we have to make sure that they're safe as well.
That is true. So what's a typical day now that you have this lack of the necessary gears that you need to protect yourself? What does a typical day look like? Because I guess normally, as you would say, you go in, you just go in, you do what needs to be done. But now that you have to be a little cautious or way more cautious, what's a typical day like?
The day hasn't changed. As I said, we always took care of patients on isolation. So that has not changed. What has changed is I work days and nights, so the week may vary. But I may leave work in the morning after working a night shift, and the protocols that existed the night before, when I return to work the next day, they have changed. And so it makes it difficult. So we get our assignments, whoever the patients are and whatever is wrong with them, we still get our assignment, but the protocols that change. And so sometimes you're a little bit, you're not sure of what you're supposed to be doing or how you're supposed to be taking care of the patient. And it's not from my hospital, it's just that they cannot make rules or change rules or protocols if it doesn't come from the Department of Health. And the Department of Health gets information from the CDC and it gets information from the government. So it's not the hospital's fault. But we are the ones that have to know, enact these protocols, and sometimes it becomes confusing, and that's when it becomes scary because you don't know if with the new information if you're doing the right thing. Because maybe what you were doing yesterday, today is not the right thing. So you're like,
Yeah.
what do I do? And that's when it becomes a little bit difficult and it changes how your day will go.
Okay, because based on what you said, because my follow-up question was going to be what are the stages when someone comes in and when they're tested once you get the results and all of that. But based on what you're saying is that changes from time to time.
Yeah, it changes from day to day, but the general principles still exist in terms of the patient will come to the emergency room. Patient will present with certain symptoms, coughing, a fever, shortness of breath, whatever the symptoms are. Um, the physician may think that the patient is a suspected case of COVID, and so the protocol will start there. Patient is placed on isolation. Hopefully, they will do the testing in the emergency room, but a lot of the things, if you are not like in the medical field or the healthcare field, when you hear these things on the news, you don't understand what is being said and the implications or the importance of it. For example, when they said the testing takes days, a lot of people will say, oh, but at least you got tested. But the days you would have now put 100 people in the hospital at risk because we don't know. And once you come in with a history of travel and certain symptoms, you probably just had the cold or a regular flu. But we now have to use all the gears. We have to know, go in COVID mode. And if you're negative, we would have just wasted all the resources. And if you came into the hospital and you had no symptoms, and they admitted you for a cut on your foot, but you had no symptoms, what happened? You just put 100 people at risk. So that's why it's so important for you to have a rapid test. So when you come into the emergency room in 15 minutes, everybody knows who you are, what you're coming in with, and we can now put the proper things in place to ensure our safety and your safety. So it's very important. But we're still waiting on it. Our president says we have it. We are waiting. We're waiting on it.
And while you wait on it, I hope it gets there quickly because the safety of all of you guys in the healthcare field, nurses, doctors, med technicians, who are really the ones battling this and most exposed, you're still the ones who have to treat us. So we need all of you to survive. What is it that you are doing? Especially guys who are watching, I have to say congratulations to Nurse Tucker. You know, she's adding a new member to her family. And even at a time as this, when that is happening, what kind of extra precautions do you have to put in place? Because you have to
Extra
deal with this.
precaution. My extra precaution is honestly. I don't know what to tell you. The truth is though, my hospital, they have been courteous enough to not allow me to be in direct patient care with COVID patients. Pregnant nurses in general. So I may be working on the units, but they try not to assign me to COVID patients. So I'm grateful for that. It comes with its challenges, and it doesn't mean that I'm not at risk. Because the other day I was exposed, and it wasn't a COVID. The patient did not come in with COVID. So the patient came in with a totally different diagnosis because I'm pregnant. I was assigned that patient, and then days after being in the hospital, the doctors are like, "Hold on, we really don't know what's wrong with this patient. Let's just test for COVID." Comes back positive. So you find out, okay, no precautions were taken because we thought this patient was a safe patient. And I think if people understand what we're going through in the hospital, they will take precautions. They will follow the protocols. They will listen to their leaders. They will stay home. They will tan and a yard. They will stay
Yeah.
because it's serious. Because even me, who I'm not really assigned COVID patient. I'm still at risk because I'm there. My colleagues are assigned COVID. We use the same
Yeah.
computers. We sit beside each other, and they tell us, "Oh, that's a low risk," But I'm in contact, but I
Mhm.
don't live in a bubble, and so they have been courteous enough. But the rest is up to me, and the rest is up to God, basically.
Well, we're praying that you will stay safe, all your colleagues will stay safe. Earlier, you alluded to the fact that there are not a lot of gears for everyone. How significant is it for you at the hospital that you work? Is it terrible to the point where you have to be repeating the mask daily, like, or it hasn't come to that?
Okay, so this is a worldwide thing. My hospital is no different. I was just talking to a friend in Bermuda, and she has the same issue. I have friends in New York; they have the same issue. So it's not my hospital that is short. When you hear them on the news that the PPEs are short, they are short. So
Where?
originally, everywhere. Originally, when we take care of patients on isolation, there are different types of isolation based on how a disease is transmitted. So, for example, the flu. The flu is transmitted through droplet, and you just wear a regular surgical mask. When we're not in a pandemic or a crisis, we have these things on the doors of the room for the patient. Every time you go in the room, you put on a mask and you throw it out. Maybe we're spoiled, maybe we're wasting resources. That's besides the point. You know, if you had a tuberculosis patient, the same thing. We had stuff, it wasn't an issue. Now, with the influx of COVID patients, you find that whatever we had is not sufficient. And I guess nobody foresaw all of this. And people may say, why is it that it's short? Can you think about it? If everybody that comes in the hospital with a fever and cough, sore throat, or whatever the symptoms are, they're assumed to be, they're assumed to have COVID. Right now, my hospital is full, right? All those patients require all of us to wear our full PPEs. Every time we go in that room, we have to have it on. Sometimes we go in the room, we ask the patients, is there anything else I can help you with? No, I'm okay. And as soon as you go to the door, they're on the call bell. I can't find my remote. You have to put on everything again because you can't take any chances. So imagine doing that 20 times, and I'm just the nurse. You have the doctor going in there, or a team of doctors, or four of them. You have the respiratory therapist, you have the lab people, you have the food tray people. People are going in the room all the time, and every time you go, you're going in, you need it. So if you have an influx of people, it's going to be short because every
Yeah.
single time you have to put it on. Before we would dump, now across the country we are given paper bags to say, hey, this mask better last you for 2 3 days. Try don't get it ripped, try don't get it soiled because you're not getting any more. It's so we have to
Wow.
now be learning how to conserve, whether or not it's safe. I don't work at the CDC, I don't know, but when you know you're not getting any more,
You have to do
you
what
have
you
to do
have
what you
to.
have to do. But
Wow.
people don't
And
understand the significance of it.
it can be scary because you guys really, really are at a lot of risk. Like it's really risky for you guys. And we need you, as I keep saying, we need all of you
Yep.
to get through this so we can get through this. As it relates to the things that are changing, because I'm sure that many things are changing. Societally, we can see things changing because I don't think the world will return to what we once knew. So, what are some of the things that you see that are currently changing, or do you think that things will change?
Do I think things will change? Of course, things are already changing. First of all, in the hospital, we had stuff, we had gears. We no longer have gears. So that's a big change for us. That's the first thing. The economy is changing. You know, how people deal with each other, social distancing. These are things that we never even knew we could ever do. People are losing their jobs. Over 6 million people in the US filed for unemployment just this week, and 3 million last week. So are things changing? Yes. People can't pay rent, people can't pay bills, people have no food, you can't do anything. So what are we going to do about it? You know, I'm in the healthcare system. I don't do economics, so I can't answer that. But things are changing, and I can't tell you that it's going to get better right now. So we just have to put things in place.
Yes, we just have to brace for the worst and hopefully we get past that and we'll be able to move along and change things. This has been so insightful. Thank you so very much. But before you go, I know that you're a yardie. We went to college together. And so, even though you're not in Jamaica, what is that bit of advice that you'd like to give those of us out here? Because you have some persons who are not, they are not following the rules, they are not practicing social distancing, and I don't know if they get it because we have 47 cases. They're like, oh, just 47 persons. I don't think they get it. So, what can you say to help those who don't to get it?
Um, you know, I think about President Trump, and this is not, I'm not bashing him or anything. You know, I'm guessing it must be difficult to be the president. But when we had 15 cases about a month ago, he said, oh, it's just 15 cases. Before you know it, it will be zero. And I don't think they took it very serious. Now, every time I come home, I look at the news and I see the number of persons that have died. And when I wake up, I look back at the news to see how many have died between the 4 hours I was asleep. Sometimes it's 700, you know. And in Jamaica, sometimes we only see 47 people. It's not affecting me. I know nobody with COVID. I know nobody in the hospital. Andrew Holness and his team, they're just extra. Why they're locking down the country? But if this can happen to the United States of America right now, the economy is crashing right now. New York is broke. The governor said it. We are broke. Right now, they are taking I just saw it on CNN where first responders, if there's somebody has a cardiac arrest where you stop breathing and you are pulseless at home, if they cannot resuscitate you at home, they're not bringing you to the hospital. They're leaving you at home because
Wow.
you are posing a higher risk going into the hospital, people intubating you. Well, you have to die to save 10 other people who will be involved in trying to resuscitate you. So Jamaicans need to understand this is serious. Whatever the government says you're to do it. Don't try to do anything else. Don't. I saw a video with the young man and they
I am
arrested
so
him.
happy they found him. I'm
And
so
I
happy.
thought that was the best thing. Make him an example because it's
Yes.
gonna happen. And if you don't curve it now, Jamaica do. If the U.S. don't have resources, Jamaica don't have the resources. I used to be a nurse in Jamaica. The resources aren't there. People are going to die. And if you don't want to be a part of that number, stand at your yard.
Yeah. I could not have said it any better. Thank you so very much for your insight. And I am praying for you. I'm hoping for the best for you and your family. I hope that, God will protect you and no harm will come near unto you. Like, honestly, sometimes we say these things and we have to believe them because at such a time as this, faith is the only thing that will keep us at a certain point. So thank you so very much for joining. Stay safe, and hopefully, we'll be able to have a conversation after COVID.
If we survive. I'm just
That,
kidding.
I'm hoping that we survive. I'm
Just
betting on
kidding.
us being on that side. So we'll be there on that side to talk about it. Thank you so very much.
No problem. Bye.
All right. Bye bye. And that's it for today's episode. To never miss another one, do ensure that you like, subscribe, and hit that notification bell. As per usual, you can leave your comments down below, questions or suggestions. We are very open to them. Thanks again to Nurse Tucker. That was very, very informative, and I will catch you in the next episode. Stay safe.